Here, we shouldn't leave town, and we should hammer this out and get it done. And not just a repeal. Hey, it was sort of early on, along with a few of the other folks at the table. The repeal was fine. I was with, but we ought to get more than a. I think the people of this country need more than a repeal.
Kind of a back and forth at the White House the other day. That was the president in one moment. Later he said, just let it collapse on its own. Next week, apparently, a U.S. Senate vote to repeal Obamacare only. No matter what happens, health care is on the line for an awful lot of people. Steve Love, president of the DFW Hospital Council. First, President Trump and a lot of Republicans say Obamacare is broken and will, without intervention, collapse on its own. True or not?
Not totally true, and I'll tell you why. Parts of Obamacare definitely need improvement. The one that's at a crisis stage is the health insurance marketplace. We need to stabilize that. But as far as other portions of the Affordable Care Act, pre-existing conditions, helping people not have lifetime maximums, having essential health benefits have been extremely helpful to people. And so we need to focus on things that need to be fixed.
Some of the things that need to be fixed, we hear from a lot of people about outrageous increases in premiums, 100% increases in premiums, copays going up, things that are not covered that you'd think would be covered. That's not exactly a success story, but is it fixable?
It's definitely fixable. And you have to realize 7% of the coverage through the Affordable Care Act impact the health insurance marketplace. So many other parts are working. Many people's premiums are going up through their normal employer-sponsored plans, which is not necessarily tied to the Affordable Care Act.
What if we went back to the days before Obamacare? Would we be better off or worse off? Let's talk about the state of Texas.
State of Texas would clearly be worse off. We had approximately 25 to 28% uninsured in Texas pre-Affordable Care Act. We're at least down to 20% now, and we didn't expand Medicaid. Had we expanded Medicaid, we would have probably helped at least another 1.5 million people.
One of the problems that we've heard for years is that people without insurance wait until they are very, very sick, or at least think they're that sick, and just show up in an emergency room. Don't go to a doctor, don't get regular health care, don't get prescriptions, don't fill the prescriptions. They just show up at the emergency room at Parkland or at JPS and say, fix me.
Yeah, and not only Parkland and JPS, any emergency room serves as a safety net. We have many people show up for primary care that unfortunately they have let get to a stage from an acuity level that they really need intensive treatment. And that really is something that the Affordable Care Act has helped. We still have a long way to go, but preventive care, primary care, should not be rendered in an emergency department.
If the insurance market is to be stabilized, you're talking about private companies here, they cannot be expected to lose hundreds of millions of dollars in every state where they operate. They expect some predictability and stability, and unfortunately right now they have neither as they look to whether or not they're going to take part in the insurance market.
You're exactly right, and that not only affects the insured and the insurance companies, it affects the providers, the physicians, the hospitals. We don't know what the reimbursement's going to be. So we need to stabilize those health insurance marketplaces, define what the reimbursement's going to be, work collaboratively together, and put together a good health care program.
Is anybody talking to the hospitals? I know the hospitals don't like the Republican plan, the insurance companies, the doctors don't like the Republican plan. Is it workable? Is it fixable?
It's definitely fixable. And to answer your question, yes. Hospitals talk constantly. You know, we treat Democrats and Republicans, right, so we don't get into politics. But we do talk to our political leaders and explain to them coverage, access, and outcomes are so important to have good health care.
Well said. Thanks very much, Steve.